Good afternoon, everyone, and welcome to today's Conflict Cafe with Dr. Clare Sieber. Clare today will cover conflict in primary care, including the different types of conflict in primary care, the causes of PCN disputes, strategies for dealing with partnership conflict, and we'll also examine how mediation works in these settings. So over to you, Clare.
Thank you very much, Simon. Lovely to be here talking to you all today and to see some familiar names on the attendees list, and also some new people this time from all over the four corners of the globe. Some of you, it looks like you work in general practice in the UK, but some of you don't. So I hope this has something for everybody. Isn't enough to bamboozle some people, and for the people that do work in this area, there's still enough information for you to learn some new things from it. Just to introduce myself briefly, my name's Dr. Clare Sieber. I am a GP. I live and work down on the south coast of England. I also work as a mediator and a trainer with the Medical Mediation Foundation. And the area of mediation that I tend to specialise in is mediation between colleagues in general practice who find themselves in conflict with each other. So this is what I'm going to talk about today briefly before we do our question and answer session. I will cover a little bit about what general practice looks like in the UK, bearing in mind that not everybody who's listening in today works in general practice or even in the UK. What types of conflicts between colleagues I tend to see emerging in this space, the common causes for these, the effect that COVID has had on these, the consequences of conflicts in this particular setting, because there can be some quite serious consequences. And then I will give anybody who on the call works in this setting some of my tips to how to avoid getting into those sorts of conflicts in the first place, or at least resolve them early on. And then I'll talk you through how mediation works in this sort of environment. Thank you, Simon. So just a little bit about what general practice looks like in the UK. So in the UK, general practitioners, or what you might know as family doctors or primary care physicians, work in practices, GP surgeries, and run a GP surgery by holding a contract with the NHS to deliver some GP services, like seeing people who believe they're ill, referring people to specialists, providing vaccinations, and that sort of thing. In England alone, there are about 6,500 GP surgeries. And these aren't NHS organisations, unlike hospitals here in the UK. They're private businesses, and it's the GPs themselves that run them. And the GPs will employ staff, possibly other GPs as well, to help them deliver that NHS contract. An average practice probably has about 10,000 patients that it looks after and employs about 35 members of staff. The GPs run the business in partnership with each other, and any profits that they have left over at the end of each month after staff are paid, etc., will then be shared between them. It is encouraged that GPs working in these partnerships have an agreement about how they'll operate, how they'll make decisions, how they'll run the contract, how they'll share profits, something known as a partnership agreement, but often that's actually lacking in those partnerships. The building themselves that the surgery operates from might be owned by the GP partners, normally with a mortgage, or it might be leased from a private landlord. Thank you, Simon. Next slide. Whenever there is a conflict between business partners, even if the conflict is a simple personality clash, then all of those sort of commercial issues that I just talked about need to be borne in mind, because a resolution to the conflict, even if it's a personality clash, usually involves sorting out some of those commercial matters in the background. So a lot of the conflicts that I deal with tend to be commercial ones in their nature. Practices also work together in small groups across their local area to deliver other services under the NHS, and they're known as primary care networks. So sometimes a conflict arises between these practices in a network, and those also tend to be very commercial in their nature. There are also employment conflicts and disputes that I get involved in general practice, because we've got to remember that the GPs that are running the the business may have a conflict with somebody in the organization who's actually an employee, and sometimes that can be about their contract, and sometimes it can go to tribunal and that sort of thing. So those sorts of conflicts are known as employment conflicts. And there are also conflicts between employees within the practice, which are known as workplace conflicts and disputes. And of course, there are also conflicts that the GPs will have with patients, but I'm not going to get involved in that today, although it is very much something that the Medical Mediation Foundation and we can all help with, but I'm just not going to cover that subject matter today. So if we move on to looking at the different types of conflict that we see and the different causes of those, next slide, thank you. Probably the most common type of conflict that I see is arisen because of a retirement. Retirement is something that happens to us all eventually, but it gets a little bit complicated when the person is actually retiring from the business, essentially, and not being a partner anymore. Sometimes the agreements that GPs have with each other mean that actually they can't retire, or they can't retire at the time that they want to, or in the order that they all want to retire. If there is no partnership agreement between all of the GP partners, then actually nobody can retire from the partnership. As soon as somebody tries to do that, the whole thing gets dissolved, and then the NHS contract has to be handed back. So it can be really quite tense stuff when partners want to retire from a partnership and there isn't that sort of agreement in place. Sometimes it's a little bit more complicated and somebody wants to retire and isn't able to, or the opposite. Somebody doesn't want to retire, but everybody else in the partnership does want them to retire. It can even be as simple as everybody has agreed when somebody's going to retire and how they're going to retire and how they're going to be bought out of any investment that they have in the business. But nobody can agree exactly how much, for example, that money is going to be, and that could cause a conflict in its own right. It's also very common to have personality clashes, I suppose, in partnerships, and the pressures of COVID have made those even worse. Some people now have a different opinion on whether to put patient care first or whether to put practice profits and running a viable business first. And if you've got people with different opinions like that within the same business running it, then that inevitably is going to lead to conflict as well. And usually that will get resolved by somebody leaving. Money, of course, is an area for conflict, not surprisingly, because GPs have got bills to pay and they're doing this because this is their work. And they're running essentially an unlimited liability partnership with fluctuating profits. They might all be working different numbers of hours. So you can see where there's lots of areas where conflict can arise around money. The building might be owned. It will need to be maintained. The value can fall as well as rise. Some GP partners actually end up in a situation where they're in negative equity, sadly, when they own the building. Sometimes when somebody wants to retire who owns the building, there is no clear agreement about whether that person should be bought out or whether that person can remain as a property owner and then lease the property to the rest of the partnership. There's all sorts of issues that can get thrown into the mix there, and premises tends to be a hotbed for conflicts. Also up there, you'll see the GMC, General Medical Council. That's the regulator of GPs here in the UK. And sadly, sometimes GPs find themselves suspended from work or maybe only able to work under certain conditions if there's some sort of investigation ongoing because of a complaint that, for example, a patient has made. And of course, if one of your business partners suddenly isn't able to work and perform the duties, but is still there taking the profits in the business, then that can cause tension too. There's also a little bit of crime and fraud, divorce, because GP business partners are sometimes also married to each other. And you name it, I've seen it. But I could write a book about it, but of course I can't because it's all confidential. But those are the sorts of things that I deal with. And then COVID has come along, and that's added another layer onto the myriad issues that can cause conflict for GPs. Some people have been ill with long COVID and haven't been able to return to work to do their full duties, which of course causes tension. People might threaten to expel a partner who's still not able to come back and perform their normal duties. And then that partner may say, well, hold on, this is a disability I've got now with my long COVID, so you can't expel me because that's discrimination. We've seen some people working from home for large chunks of the last 2-3 years, and that causes tension, perceptions about who's working harder. And of course, if somebody's at home and the rest of the team are in work, then there's a communication barrier that wasn't there before. The workload in COVID has increased in the NHS, and it probably was fair to say that the workload issue was bubbling over anyway pre-COVID. So it's now boiled over, if you like, and we're now beginning to settle back down into a new normal. We're seeing some GPs very desperate to go back to the old way of working, so to speak, with full surgeries of face-to-face appointments, allowing people to have walk-in appointments, whereas there's another bunch of GPs who much prefer to do things remotely, perhaps triage all of the patients first before they come in. And if you've got business partners, again, within the same business that have a different way of viewing how that new normal should look, then of course that's going to cause tension. We've also pondered life a bit more in COVID and all of this lockdown business that we had, and some people have decided to reduce their working hours or take sabbaticals now that the world has opened up again to travel. Those sorts of things are causing conflict as well. And now on top of that, the next big thing for general practice is the cost of living crisis. Bills are going up, staffing costs are going up, but the funding that GP practices are receiving for delivering the NHS contract isn't keeping up with inflation. So the purse strings are even tighter. The consequences of these conflicts, well, some of the people involved in these conflicts, of course, are clinical staff, people that are seeing patients on a day-to-day basis. And so if those people are struggling with a conflict, they may not be performing as well at work. And of course, that may present safety issues if patients are involved, which of course nobody wants to see. It's actually been shown that there's a link between those GP practices that earn well and have higher profits and those that don't have many disputes. And we know that practices that do have disputes going on generally have lower profits, probably because they're turning over lots of staff, or maybe just it might be as simple that they're not able to keep their eye on the ball so much in terms of running an efficient, cost-effective business because they're busy trying to resolve a conflict in the background. The CQC, the Care Quality Commission, which is the regulator of GP surgeries in England, will come in and inspect practices, and invariably if there's a conflict going on, they will spot it. If it's a conflict within the leadership team, for example, between those GP partners running the business, then that can affect the CQC rating of the practice. It's something that they do pick up on. And of course, if they're picking up on it, then so is everybody else, and the grapevine is going wild, and it's very difficult to recruit people into your surgery when everybody knows that there's a sort of issue going on in the background. And sadly, we do see it. Some GP partners have got such a sort of deep-rooted conflict that they just can't seem to resolve, that they think, that they find it's easier, cheaper, quicker to actually dissolve their partnership and hand back the NHS contract than it is to try and sort out the dispute, which is just really desperate situation, not one that anybody wants to see happening, whether you're a patient or a GP or somebody who's commissioning these services. So there are some simple steps that people can take to help to minimize these conflicts from arising, or should I say these really destructive ones for arising, because we've got to appreciate that conflict is around us all the time, and actually a decent team needs a little bit of conflict, but a conflict that they can manage constructively in order to improve and grow and thrive as a team. But the destructive conflicts are not ones that we need. So these are my simple tips. The first one would be that these partnership agreements that I've talked about, same with contracts for staff, same with staff handbooks, they need to exist in the first place. And that might sound like such a silly thing for me to be saying, but a lot of these businesses are operating without people on contracts and without an agreement between all of the business partners. But if you've got these things in place and they're valid and they're up to date and they reflect what you're doing and provide for all of the things that you need them to provide for, then there's simply less to argue about in the first place. But there's also the opportunity when you're in a conflict for you to be able to pick that agreement or whatever it is up, and it will set out a framework for how you might try to resolve it in the first place. So that's a couple of reasons why having that paperwork in the background is so important. But there also needs to be a little bit of governance beyond that as well. So when decisions are being made, they need to be made properly, communicated properly, recorded properly. Again, that might sound like a silly thing to say, but a lot of these business partnerships will run without the business partners meeting regularly. Indeed, sometimes I meet partnerships where they don't meet at all and can't remember the last time that they did meet. It was certainly more than a year ago. And you might think, well, how can a business operate if the partners aren't sitting down together, even at year end with their accountant to look at how they've done? It's generally because they've got a very good practice manager running the show in the background. But if you're not meeting and you're not communicating properly, people will be misunderstanding things, there will be miscommunication, people will be left out, things will be going through third parties. You need face-to-face conversation with context and body language and rapport and the sandwiches and all that sort of stuff to minimize the chance of these conflicts happening. And people also need to be socializing together as well. Many of the teams that I work with, they don't have any sort of social events, even just a quick coffee once a week where they all sit together, because you're never going to have that culture of dealing constructively with issues and debating things and people being able to speak up early on if you're not doing that. So people need to meet, talk about their values, their passions, their private stuff that's going on, pets, hobbies, grandchildren, doesn't need to be work stuff, so that there's this culture of sort of trust and inclusion that builds up. And if people are used to communicating regularly, then they'll be better at communicating as well when there is a conflict, and there'll actually be opportunities to bring things up earlier on because there's these regular social events going on. And when things are brought up earlier on, they are always easier to solve. And let's face it, it's much harder to get into a really bitter conflict and dispute with somebody if you're having to meet them at least once a week for a coffee and sit with them. It's just a harder thing to do. So those are my top tips for getting yourselves out of and avoiding yourselves from getting there in the first place, these really difficult conflicts. They sound easy, but honestly, in a lot of cases, almost none of those things are being done. So how does mediation work in these specific settings? Well, the same principles that apply to mediation anywhere apply here as well. So mediation is voluntary. Nobody can be forced to go into a mediation. And likewise, once they're in the mediation, if they don't want to carry on with it, they're allowed to walk away. Indeed, they could stay until the end and then just decide actually that they don't feel comfortable for whatever reason in agreeing everything, because there is no obligation to get an agreement at the end of the day. It's also completely confidential and without prejudice, which is just legal language for being legally confidential. So anything that is said in the mediation can't be used against somebody in an ongoing or a future court case. So somebody can say sorry with impunity or offer to pay for something, knowing that they can't make things any worse for themselves. So mediation gives people a safe space, particularly business partners, to discuss commercial things confidentially, knowing that they can't put their foots in it anymore legally, so to speak. The mediator acts just as an independent person who is not making any decisions and not giving any advice. They're just helping the people in the conflict to come to their own solution for how to fix it. And so therefore, the solution that is got at the end of a mediation is always completely unique and covers all sorts of things that nobody would have thought would be needing covering at the start. It's much more creative than going through court or arbitration, because you can really stick whatever you want in there. It's very flexible. It normally works with some initial meetings at the beginning with each of the parties involved to get them really thinking about how they want the issue to be resolved. Because one of the things that people tend to get stuck in a little bit when they're in conflict is the I'm right, you're wrong, I'm going to sue you, I'm not going to quit. Very positional. And sometimes people need a little bit of help to think about what they might want, or even better, what they'd be prepared to accept from an outcome, because not everybody has actually thought about that. So there's quite a lot of meetings that go on in the background before a mediation, so people are confident about what they want. And sometimes they have meetings with their lawyers so that they're clear about what they might be entitled to and what the alternative to doing a mediation would be, so that they know just how much they may want to avoid going down that sort of route, and therefore how much they might be prepared to negotiate to get a deal on the day. Everybody has to be involved in one of these commercial mediations. So let's say there's a business partnership of 7 GPs, but there are 2 of them that are at loggerheads about something. The mediation may just focus on those 2 and what they want, but absolutely guarantee you that some of the outcomes of the mediation will be commercial ones to do with how that partnership is being run. So even if the other partners are just involved on the periphery, they do need to be involved, and they need to be there signing an agreement at the end of the day to make sure it's actually legally binding and not a chocolate teapot. And that's the normal outcome from these mediations, is at the end of the day, you do get a legally binding settlement agreement that then covers off all of the loose ends that are going on for these GPs and their business that they're running, and everybody leaves happy with everything resolved. So this is me. If you'd like to get in touch with me through the Medical Mediation Foundation, these are my details. Happy to answer questions that come in through the emails, or have confidential conversations about your unique situations. But let's go to some questions now. Thanks, Simon.
Thank you, Claire. That was great. Thank you very much. Just a couple of things to close on before we finish. 2 seconds. So, firstly, big thank you to Claire for today's presentation. Our regular kind of conflict cafes that we run every month. There are a couple of spaces left on our accredited pediatric medical mediation training. So if you are interested, do get in touch with myself. Visit the website. There's a lot of information on there. I think this is the third year now that we've been running this training. And then we're also, as we grow into sort of 2023, we're looking for associates to kind of join the MMF team. So the majority of all our associates come from varied backgrounds. You know, Oscar is a barrister, Claire, who you've met today, is obviously a GP, Essie is a paediatric doctor. So everyone comes from a slightly different background. You know, I think Sarah was originally a journalist. So if you'd like to know more about joining the team and helping with our training and mediation, then again, do drop me an email and get in touch. Finally, we've got 2 conflict cafes coming up. One is coming up at the end of February, which we'll be announcing in the next couple of weeks. And then we've got another coming up at the end of March as well. So you can keep track of those and register online on the website. You can also go back and look at the previous recordings of the other cafes. We've been doing these now for about 12 months. So there's a really good kind of bank of cafes for you to view on all different subjects related to managing conflict in healthcare. So that is it for this month. Thank you very much for your time. And we look forward to seeing you next month for the next cafe.